To understand how glaucoma affects your eyes, it is important to understand how your eye sees. Light rays enter the eye through the clear cornea, then through the pupil and the lens. These light rays are focused onto the retina, a light-sensitive tissue lining the back of the eye. The optic nerve is connected to the retina and is made up of many nerve fibers. Signals from the retina are sent through the optic nerve to the brain, where they are interpreted as the images we see. In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. If you have glaucoma, the aqueous humor does not flow through the drainage angle properly. Fluid pressure in the eye increases, and this extra force presses on the optic nerve in the back of the eye, causing damage to the nerve fibers. A less common form of glaucoma, called closed-angle glaucoma, occurs when the drainage angle of the eye becomes blocked. The iris, the colored part of the eye, may close off the drainage angle. People of Asian descent and those who are farsighted tend to be more at risk for developing this form of glaucoma.
A normal optic nerve is made up of more than 1 million tiny nerve fibers. With glaucoma, as the optic nerve is damaged, it loses nerve fibers. As a result, the appearance of the optic nerve changes. We refer to this as cupping. As the cupping increases, blind spots begin to develop in your field of vision. Ophthalmologists use a technique called a visual field test to look for these blind spots. The results of this test show us if and where blind spots are appearing in your field of vision, spots that you may not even notice. In the early stages of glaucoma, the visual field remains normal. As the optic nerve experiences further damage, blind spots begin to appear. These blind spots typically go undetected in your day-to-day activities until the optic nerve is significantly damaged and the blind spots become large. If all the optic nerve fibers die, blindness results. Always wash your hands before putting in your eye drops. Remove the cap to the eye drop medication and do not touch the dropper tip. Tilt your head back slightly. With one hand, pull your lower eyelid away from the eye to form a pocket. You can do this by pulling the lower lid down with your index finger. With your other hand, hold the dropper tip directly over this eyelid pocket. Look up and let the eye drop fall into the pocket without touching the bottle to your eye or eyelid to prevent contamination of the bottle. Close your eyes and do not blink, and apply pressure to the point where the lids meet the nose. Hold for 2 to 3 minutes, or as long as your ophthalmologist prescribes. Before opening your eyes, and this is very important, wipe unabsorbed drops and tears from the closed lids with a tissue. Then open your eyes.